who you are, right? Okay, I think we can start, So
Okay.
to be fair for everyone, whoever that comes in later, I think they can just join in, right? Okay, so thank you everyone for taking time off after dinner, to join us. So today is my second session, and I have a special
It's
guest
my
with me,
first.
Yan Lin. So I'm
Hello.
sure, yeah, most of you know she's my wife, lah, right? So in case you didn't attend a wedding or something, so okay. Anyway, so the reason why actually we are doing this is because we feel that in preparation of COVID, getting very real and very serious, right? And of course, in line with what the government is telling us to do to be socially responsible, and at the same time, we actually want to provide updates, and ideas from the financial planning industries to all our friends and clients, lah, right? So we actually plan to do this webinars, one topic 3 times per week. So on Sundays, Sunday will be the new launch of a topic. Then a repeat will be on Tuesday, which is today, and on Fridays will be a lunchtime session at 12:30 p.m. lah. Okay, so this coming Sunday will be the new topic. So keep us check for updates on Facebook, and of course I'll send out the WhatsApp blast lah. So let's begin today's session. Okay, as the topic says, this is an introduction, and COVID-19, am I covered? Okay, so today's program, I'll try to keep it to be about 20 to 25 minutes, and if time permits, right, we will do a short Q&A session. Okay, so program for today, we'll do a quick introduction and touch a bit about current COVID situation. What are some of the government initiatives rolled out so far? The financial impact that COVID-19 has caused, and some of Great Eastern's initiatives, and a very common question that I get, from clients and friends is, what does your existing insurance cover you for? And of course, we will sum it up, and followed by a Q&A session, lah. Right? Okay.
Waving to Margaret.
So a quick introduction, right? I think COVID-19 is a very real and very serious issue that has a huge impact for on our lives and work, lah. So for most of us, I think we all working from home. Our jobs are slower, slightly affected, lah, but not a immediate concern. But there are people who are less fortunate, I guess. The self-employed people. We have our real estate agents, we have our Grab and taxi drivers. I think immediately from COVID, right, they suffer a financial loss immediately, lah. So I think this is a very good time for us to adapt, and change many aspects of our lives, how we lead our lives, and of course, financial decisions as well, lah.
Yeah.
Right.
So yeah. Okay, so thankfully, right, insurance is still considered an essential service in Singapore. Okay, so to our clients, right, not to worry, you'll still have our continued support. Okay, rest assured that, let's say, if it's regards to claims, policy servicing, or even like, let's say, a new policy application. Okay, Great Eastern has actually adapted really fast. Okay, our company has actually implemented non-face-to-face policy application. So during times like that, our clients are also worried. A few of them has asked us about what their plan covers and all, and they probably want to also implement the basic necessities lah. Okay, so because all of us are supposed to stay at home. Okay, so let's say if you are looking to implement any policies or plans, okay, we don't have to meet up physically, so through a phone call or video conferencing like this. Yep.
Okay. So just a bit on the current COVID situation. I think everyone knows from the news that every day Singapore and globally, right, the numbers are just rising every single day, right? So globally, there's about more than 1.3 million cases, and about 75,000 fatalities, lah. Okay, so also the concern is asymptomatic cases. So meaning to say there might be actually more people infected with COVID-19, but because they don't show any symptoms, and that's why the rise in community spread is getting very high, lah. Leading to our PM Lee, right, needing to suspend all non-essential businesses, from today. In fact, this is our first day until 4th of May, lah, which is a Monday. So that's a day actually I think most of us will look forward for, if it doesn't extend, lah. Okay. And also, right, as some of you and I think most people will know, right, global financial markets are very down and very unstable. So you might have heard people say, some of our friends say that, stocks and shares are very low now. Is it the best time to enter now? Just a word of precaution. Just do your own research. Understand your own risk appetite and what you are getting into. So if you need to make that financial decision, right, please do so at your own discretion. Okay, so as Lawrence Wong, our minister, said, actually this whole situation might drag even longer, and maybe even end of the year. So we need to be prepared for this, right? Okay.
Yeah. Okay, so most of us already know the Singapore government. They have actually done a really good job, in providing like various initiatives and support, that we need. So basically, okay, currently all Singaporean PRs or long-term pass holders, if we are warded due to COVID-19, right, into a government hospital, okay, all our bills will be covered for. Okay, so our own personal insurance at this point, you don't have to utilize your personal insurance lah. Okay, so yeah. Okay, so there are also various support from the government for employees, employers, and self-employed. Okay, as we know from the resilience budget and the solidarity budget that's announced recently. So, for example, like the cash incentive, tax deferment, waivers.
Household will receive more vouchers lah. So I think the government is doing a fantastic job. Okay, so just on a side note, right? I've actually called up MOH, right, to check. So during this period, if you're hospitalized due to COVID-19, right, all bills will be paid by the government, but with the exception of post-hospital bills, outpatient bills. So meaning to say, if you are recovered from COVID-19, and for all follow-ups or medications after that you are discharged, right, they are not paid by the government. So I'll touch a bit, in details on this topic later, lah. Okay. So just a quick thought. I think that our government is doing the best they can, for all Singaporeans and citizens. And likewise, I believe we as individuals, right, we can actually make the best of today, and make the best social decisions, and of course financial decisions lah. So stay at home, be safe. All right.
Sorry, my client.
Okay. So moving on, I think let me touch a bit on the financial impact that COVID-19 has caused. So globally, financial markets are down and unstable, but more immediate concern I feel to us is even our 3 local bank account rates are being revised downwards from 1st May onwards. So these are high yield bank accounts, right, from UOB, DBS, and of course OCBC, right? All rates from your salary crediting to your credit card spending to your month-on-month growth, all the rates will be revised downwards, with the exception of OCBC salary crediting bonus. So they actually increased it from 2% to 2.4%. So I think well done OCBC lah, on this particular area. So across all 3 banks, all criteria, this is the only rates that increase. Okay. So with that, right, I always think that this might actually be a good time for us to think about where you allocate your resources. Since all the rates are down, maybe you should place some money into something that gives you a higher return. Okay. And of course also for homeowners, mortgage rates are low as well. So do a refinance if you're eligible, and also reach out to us, if you are keen to do a refinancing lah, because we have a direct tie-up with OCBC Mortgage, and actually we can do that for you as well. All right. Okay. Okay. So for investments, so same thing. A lot of clients and my friends especially, keep asking me, these are the top 3 questions that I received so far. Question number 1 is, since share price are so low now, right, can I make some quick cash from this? The short answer is yes, but this question has many factors to it lah. I feel that the 2 biggest considerations is number 1, your risk appetite, and number 2, your holding power. Okay, so meaning to say, just to quote an example, right, DBS shares, for example, now, we are trading at about 20 to 30% lower than pre-COVID. It's about $18 today. So is it the best time to buy, get into the stock market now? So back in 2008, during the actual financial crisis, right, it was actually down to as low as $8 per share. Now we are at about $18. So when is the bottom? As of now, nobody knows for sure, I guess. So I think you have to, do your own research. If you feel that this is the best time to get into the market now, please do exercise precaution, and we can do that, of course, at your own discretion. Okay. Question number 2, I've got some spare cash, what do I want to start investing, what do I do now? So same thing, there are many instruments out there, to suit different risk appetite, even in the same class of asset, right? There's a lot of shares to choose from, there's a lot of unit trusts to choose from. Okay, but in short, normally what I do for my clients is I will split the investment up 2 parts, a single lump sum investment, followed by a series of smaller amount of regular investments. So I think by doing this, right, this will help to diversify the risk if the market drops even further. Okay, but of course this is not a product or investment recommendation. This is an idea that I've done for a lot of my clients lah. So actually, if you're keen to do or understand a bit more, of course, please reach out to us, right? Okay, and the third kind is actually these are my favorite kind of clients lah. I don't know anything. I have no time. I have no interest. Just help me grow my money lah. Make some money can already lah. Can you help me? Of course, the very very short answer is yes. Leave it to me. We can have a discussion. Put into something lower risk. Pays a decent dividend. With dollar cost averaging. I think this can be addressed lah. So today is just an introduction. I'm not going to much into details. But this coming Sunday's seminar, right, will be very much investment focused lah. So if you feel that this is something that you are interested on, please share this links and to invite all of your friends, your colleagues, or whichever to tune in lah. All right. Okay.
Yeah. Okay, so I'll be touching more about Great Eastern's initiative. Okay, so for some of you who actually don't already know, right, Great Eastern is actually owned by OCBC Bank. Okay, we are actually listed on SGX. In fact, we are the only insurance company, right, in Singapore that is owned by a bank. Okay, so in light of this virus, even if it seemed like there might be a potential financial crisis, right? Okay, Great Eastern has actually launched a $1 million customer care fund for all our policyholders and our immediate family members. Okay, so what policyholders includes a policyholder with life policies, accident and health, ElderShield, your DPS, okay, general insurance clients who have motor insurance with us or annual travel insurance policies. Okay, so these benefits, right, for COVID-19 are extended to you automatically, okay, to policyholders and their family, so no application is required. Okay, so the coverage, right, consists of two parts lah. Okay, the first one is a $200 per day hospitalization cash incentive. So as long as one is warded for COVID-19, you receive $200 per day all the way until for 60 days. Okay, so the thing is, this $200 a day would probably be very important for someone maybe like a self-employed or a small business owner. Okay, because it actually helps to replace your lost income. Okay, and the second coverage is a $20,000 death benefit, okay, if the patient were to be passed on due to COVID-19. Okay, so let's say if you have any questions regarding this, or you know of someone who maybe wants to do a claim or just wants to find out more, right? You can contact us. We are still working from home. Okay.
Yes.
So anything that is like claims related, policy servicing, okay, our customer service hotline service centers are still open, and let's say if any one of you plans to do a new policy application, then we can meet through Zoom or we can do a phone call.
Yep.
Yeah.
Okay, so just a quick thought, right? I think everyone loves free stuff. So Great Eastern or any other insurers or the banks gives out free insurance coverage, right? Nobody will reject it. In fact, actually, you will want more. Okay, so we know that the value of insurance is there, but it is the cost of insurance that people are rejecting. Okay, so with that, right, I feel that with proper financial planning, cash flow analysis, I think these issues can be solved. So yeah, just a quick thought about that, right? Okay. The next initiative rolled out by Great Eastern, and in fact all of the insurance company, right, is this deferment of premium program. Got a lot of questions from this. So eligible clients basically can apply for a deferment period of up to 6 months. Okay, so but you have to prove that either there is a loss of job or there is a much reduced income, so in order to apply for this. Okay, so the thing is, once the deferment period is over, all previous premiums must be paid lump sum within 30 days. So I feel that this actually might be a double-edged sword, because if someone applies for this program, after 6 months and COVID is still around, you might have issue paying, this past 7 months of premiums, right? And we wouldn't know for sure whether this program will be extended, because it's still very new, and of course it's to help people immediately that has who are financially affected. So do speak to us, do come to us if really you have financial difficulty paying, servicing any, not just Great Eastern, any insurance policies premiums. Let us know. We actually guide you through how to do this application for deferment, right?
Yeah, okay, so just a thought on my part as well, right? So as a financial consultant, we always like emphasize to our clients, cash flow is a very important aspect of your financial planning, be it personal or business. Okay, more so for businesses that are cash intensive. Okay, so it's always very important to track your expenses, to set up your emergency fund of 6 to 9 months. Okay, such that in unforeseen circumstances, like maybe like today, right? Even if your industry or your job is hit very badly, okay, as long as you have your emergency fund, right, you know that for sure in the next 6 to 9 months, right, you are financially safe. Okay, so let's say if you haven't reviewed your cash flow, or you haven't even set up maybe 6 to 9 months savings in your bank account, okay, it's time to do so. If you are unsure, you can actually approach us and we can help you accordingly as well.
Yeah, and we do
Yeah.
it for free lah. So yeah, it's a complimentary service by us, alright? Okay. So next.
Yeah.
So okay, so what does your existing insurance coverage covers you?
Okay, so we all actually know that the Singapore government will foot the bill of infected patients at public hospital, except outpatient expenses. Okay, so what do outpatient expenses mean? Okay, take for example, right, in the last 3 weeks, I'm actually feeling unwell. I have been seeing the GP, and until today, right, I have chalked up about $300 in bills. Okay, let's say I get admitted to the hospital for COVID-19, right? My past outpatient expenses, right, will not be covered by the government. Okay, but if you have your Supreme Health and your Total Health insurance plan, right, okay, all these bills, okay, that you incur 4 months before your hospitalization can be covered by our Great Eastern Hospital plan. Okay, let's say upon discharge, okay, a patient gets discharged from COVID, and probably after that, he or she still needs to take medication or go back for follow-up, right? This is still considered an outpatient expense. Okay, so you can actually claim from your Great Eastern plan for up to a period of 6 months or 1 year. Yeah. So this is not only for COVID-19, but for any other medical conditions, accidents, if a hospitalization were to occur. Yeah.
Right. Okay. And so for the second part is this daily hospital cash insurance policy that we have. So as mentioned earlier, right, currently, if someone is tested positive for COVID-19, this customer care fund, hold on, right? This customer care fund will provide $200 per day for up to 60 days. So some of my clients actually ask me, if I want to extend this period, is it possible? The answer is yes. We have this policy called Supreme Medicash. It actually will insure you up to 500 days, and this amount that you purchase, it will be doubled if it's an accident or tripled if it's an ICU. So meaning to say, if let's say today I have a Supreme Medicash policy in my current insurance portfolio, right? I'm admitted to the hospital from COVID-19, I'll be receiving $400 per day. And if, let's say, my COVID situation becomes an ICU case, the amount will be tripled to $600. And on top of that, with the $200 customer care fund, I think in total, there'll be $800 per day of benefit. I think this can be a substantial amount and is handy for times like this, of course, affecting everyone's job and families, right? Okay. And if you look at the premium stated there, I think it's a very affordable premium, $35. It's something very bite-sized. I think now, not a very big commitment. For yourself or even for your whole family, this is something that you can consider, putting in taking up and putting inside your portfolio now, right? Okay,
Yeah.
and last but not least, of course, we have critical illness.
Yeah, so for your critical illness insurance, right, actually all of you probably would have already some critical illness insurance in your portfolio. Okay, so this plan actually pays a lump sum payout, be it like 300,000 or 500,000, in the event of a critical illness. Okay, so end-stage lung disease, right, is actually one of the listed critical illness in this plans lah. Okay.
Yeah.
Yeah. So we have actually checked with our claims department. Okay, if COVID-19 leads to end-stage lung disease, okay, your claims will be paid out. Okay, so you receive a lump sum instead. Yeah. So something else to take note on this plan is in the future, right? Let's say, okay, even for a COVID-19 patient, he or she recovers from this condition, okay, because the virus targets the lung, right? Okay, in the future, if you were to apply for a critical illness insurance plan, there probably would be an exclusion to the plan itself. Yeah.
Okay, so let me just talk a bit about this particular quoted premium over here, right? This is actually our Great Eastern's newest term plan called Great Term. This is actually our first term insurance to cover for death, total disability, and critical illness up to age 100. Okay, So for people who are breadwinners who actually want to leave a legacy, or even for homeowners looking to upgrade your homes in the near future, right? This is a good time, I guess, to increase your critical or death insurance coverage, at this point in time lah. So premiums, we have did a comparison. We are the lowest across the 100-year-old term insurance market lah. So I think we are the most affordable in the market right now, right?
Yeah.
So
Okay.
okay, so quick, we are coming to the end lah, basically, right? So in summary, right, just a couple of questions to ask, for yourself, right? Are you financially prepared for events such as COVID-19 or anything that is unforeseen? Okay, is your cash flow in a healthy level? So, do you even know what is a healthy cash flow that, cash flow means to yourself or your family, right? And even to tide through this period, when to invest, when shares, equities, almost everything are undervalued. What to invest, how to invest, do I need a lot of money, and of course, last but not least, when was the last time you looked at your insurance portfolio? So at this time, Great Eastern has no choice but of course to launch a lot of promotional campaigns, and with most of us, working from home, I guess we can spare that extra 30 minutes or so to look at your existing portfolio. Maybe you can consider doing a review with us. Okay, so the three things that I mentioned earlier: number one, Supreme Medicash, to increase your daily hospital cash benefit. Number two, Great Term, to increase life, TPD or critical illness coverage, at very affordable rates. And of course, last but not least, right, most of you guys are our clients. So do request your updated policy summaries, if you need them, and we can actually, have a discussion after that, lah. All right. So if any of these, questions that post out, or you have any, questions that you would like to find out more, do reach out to us, lah. I guess we are, we are here to continued service, no business suspension, right?
Yeah.
Okay. So yes, Q&A. Let me see with any questions that anyone has posted. Is there anything that anyone ask you?
I think so far not yet.
Okay, today's session is very good. Nobody has much questions. Oh, one actually. Hold on. Okay, premium deferment. The deferment program, right? No, there will be no interest charged. So for this deferment of premium program, right, there will be no interest charged to this lah.
Yeah.
Okay, so one more question. The government has just passed the bill of a no social gathering of any size. If I infringe this and unfortunately or deservingly tested positive for COVID-19 during such a social gathering, does GE still provide the insurance coverage you have mentioned? I think, basically, based on the,
they can reject one, right? Because most plans also, if it's like not
against
the law.
Yes, if it's something that is against the law, or it's illegal to, and you have committed a crime technically, right? Great Eastern has the right to don't pay for such a claim. Okay. But of course, that being said, right, I think at this period, right, it's somewhat very grey in terms of.
But our in-house lawyer has spoken.
In-house lawyer, no lah, So of course, I wouldn't commit saying that Great Eastern will surely pay for this, right? But of course, I feel that everyone should not you should follow the law, not head out and go on any social gatherings as of this period lah, So
Okay,
really,
anyways, no fixed answer for that lah.
yeah, I think there is no. I wouldn't commit to the answer. Let's put it that way, lah. Right? Okay. So any more questions? Yeah, I think hopefully you feel that today's session is useful and informative, right? I think this is just an introductory to what we're gonna do, and I think most of it is very surface details, lah. Some of the updates here and there, But I think moving forward, the subsequent seminars will be more in depth and more information, lah. Right? So if you have more questions, just WhatsApp, call us, lah, and you can Zoom us as well, lah. Okay. So as mentioned earlier, right, this is the schedule that will be running. So the next coming one will be on Friday, 12:30 p.m. So lunchtime people, we can have lunch together as well, lah. Right? The next one, as I said, will be investment focused. So the how, the what, and the when. So this coming Sunday, 8 p.m. will be the launch of this particular topic, lah. So yeah, how do you start investing? You know, what is good to invest in? What is shares, unit trusts, ETFs, investment linked plans? Is it a good time now? Bad time now? Concept of that dollar cost averaging. So I'll be, it's still work in progress. I think there's a lot of research to be done. I think this is something that yeah, there's a lot of interesting findings that I did even this afternoon so I think this is something that you guys can look forward to this coming Sunday, right? Okay. Hold on.
If premium is unpaid during deferment and there is a death, is policy payable?
If premium is unpaid during deferment, is yes, of course. So I think that so the question posed is during the deferment period, right? Is the policy still in force? The immediate answer is yes. All your policies are still in force, just that you skip paying your premiums and pay it at a later month. So any claims coming from these policies that is on deferred, right, is still claimable in that sense, right?
She's telling us. Okay.
Okay. So with that, I think we'd like to thank everyone for your time. Contact me, if you have any queries, via WhatsApp, via email. I have my Facebook page. Please do like and share. I've been trying to promote my page for the longest time. So it's facebook.com/billytan.gefa, right?
Contact Billy. Contact Billy for my contact number.
Okay, and of course I have run my own personal financial planning website. This is what actually we do on a more comprehensive level. So do check it out. It's onpointfinancial.com. So it shows various examples of cash flow analysis, various financial ratios. How do you calculate retirement, or even how to calculate how much insurance do you need. So do drop by. So after this session, I think okay, that's the end already. So any feedback, honestly, just we do appreciate any feedback, in terms of the content, the timing, anything that can be improved on. Do let us know. I think we're trying to improve this thing along the way,
Or anything you want to hear, maybe.
Yeah, any topics that actually might interest you. So I've gotten some from Sunday's topic is about wills and trusts, doing nominations for insurance and CPF. So this might be one of the topics that I'll be touching on in the